Namaste everyone. In the earlier class, we learned about all the basics of this Ayushkamiyam Adhyayam, the basics of the how doshas reside in our body, where all they reside, what are their functions, and how do they influence in our day-to-day activities and all. We also learned about the introduction of the roga in the previous session. Now we'll learn about the examination of the patient and the disease, that is Roga Pariksha and Rogi Pariksha. Acharya has beautifully quoted one such shloka which explains examination of both the Roga and the Rogi. It states, Darshana Sparshana Prashnai Pariksheta Charoginam Rogam Nidana Pragrupam Lakshanopashayaptibihi. So learning the shloka gives you very good weightage in your answer. Rogi Pariksha can be done by three ways, according to Acharya, that is Darshana, Sparshana, and Prashna. Darshana refers to inspection. So you see the patient and analyze what all he is suffering from. Or else there are some classical, typical features through which you can properly analyze what the patient is going through. There are some gaits which tells you what is the exact cause. For example, ataxic gait. The patient is walking from the door in your OPD, from the door to the seat. He walks in an ataxic gait, so that you will come to know there is some problem with the cerebrum or the cerebellum. You can diagnose on seeing such signs. So this is darshana. On seeing, you examine the patient. And sparshana is by touching. Any means of touch, that is palpation or by percussing, you come to a diagnosis what the patient is suffering from. And from prashna, by seeing also, some things are there, by seeing you cannot come to know. Even by touching, you will not understand why that is happening. You can get to know by interrogating, by asking relevant history of the patient. What did he consume so that now the condition has got aggravated, such things. So there are three, Darshana, Sparshana and Prashna for Rogi Pariksha. Now we will examine the Roga. Disease, how will you understand? It is through five means. They are called as Nidana Panchaka, Nidana, Pragrupa, Lakshana, Upashaya and Anupashaya, and Samprapti. Nidana refers to the causative factors. You did this and the next moment you got that disease. Okay, that is the causative factor. Causative factor can be from internally or from external. Pragrupa or Purvarupa, it is just the premonitory symptoms. Suppose you had a lot of ice creams today and day after tomorrow you are catching cold. Okay, in between that two periods, the irritation in the nose, irritation in the throat you get before cold is called as Purvarupa. Just before the onset of the disease, what all the signs and symptoms you feel, that is Purvarupa. Coming to Lakshana, they are the proper signs and symptoms of a disease. For example, we took cold, common cold, running nose is your Lakshana now. Okay. Through that, you will come to know, yes, I've caught cold. Upashaya and Anupashaya, they are the aggravating and relieving factors of that disease. In Pinasa, that is rhinitis, the Upashaya can be some hot or cold, some hot fermentation, some steam taking, and Anupashaya is, it is going to aggravate your condition, that is eating another ice cream today. Samprapti is pathogenesis. Samprapti is a nutshell of what did you take as a nidana, so that how did that disease progress and now it is a disease, and what are the complications you can expect in the future. So that whole set of things is called as samprapti. Okay. Moving on to the next. Desha Beda. Acharyas explained this as Desha Beda. Desha Beda came suddenly into picture because Acharya considers our Deha also as Desha. Okay, there are two, Bhumi Desha and Deha Desha. About Deha Desha we learnt, no? About Kaya Chikitsa we learnt, what are all the doshas residing the Deha and all we learnt. Now we'll learn about the Bhumi Desha. This is important because Deshas also influence on what rogas we get. There are some typical rogas for Jangala Desha, Anupadesha. Sadharana Desha is neutral. Okay. So, there are some drugs also we get from that source, Jangala Desha or Anupadesha. That's why it is important for us to learn about the Desha, Bhumi Desha. Jangala Desha is Vata Bhuishta. In Jangala Desha, too much of Vata predominance will be there. In Anupadesha, it is Kapha predominance. In Sadharana Desha, there is equilibrium of the three doshas. Kala. Why we have to learn Kala in this context is because we have Vyadhi Avastha. Okay, like we considered Deha Desha in Desha, in Kala we have Vyadhi Avastha. That is why Kala is important. Ksharnadir Vyadhi Avastha cha Kalo Beshaja Yogakrit. Okay, Kshana Adi refers to minutes, seconds, hours, days, weeks. We are counting the Kala. That is one division, and another is Vyadhi Avastha, whether it is in Ama Avastha, Pachimana Avastha, Pakva Avastha, or some Vyadhi for say Pinasa. It is in Purvarupa Avastha, Rupa Avastha, or some Upadrava Avastha. You will come to know, no? That's how we calculate Kala with respect to Vyadhi in the form of Avastha. That is important because you will select the medicine based on the Avastha of the disease. So a person with Roga came to you. What will be your approach towards him? How will you treat him? How will you treat the disease? That is through Shodhana or Shamana in Ayurveda. Okay. Shodhanam Shamanam Cheti Samasa Doshadaudvida Sharirajanam Doshanam Kramena Paramarshadam Bastir Virekuvamanam Tata Tailam Pikritam. Aushadha is divided into two branches now. That is Shodhana and Shamana. Shodhana refers to expulsion of all the doshas which is causing disease. Okay, you're completely expelling it out through Basti, Virechana, Vamana. This order you should remember because Basti is best Shodhana in Vata, Virechana is best Shodhana in Pitta, and Vamana is best Shodhana in Kapha. Similarly, Shamana refers to you are relieving from the disease. You are not expelling the doshas out, you are just relieving them. Okay, that is through Taila, Grita and Madhu. This order is also important. This follows Vata, Pitta and Kapha. Taila is best for Vata, Grita best for Pitta and Madhu is best for Kapha. Madhu is your honey. Okay. Treatment of Manodosha. This is for Deya dosha, Shodhana and Shamana. For Manas, how will you treat? You will treat it through Dhidairyatmadi Vijnanam Manodosha Param. Through Dhairya Atmadi Vijnana. You are going to counsel them. You are going to do some therapies. So, for example, flooding therapy and all are there in psychiatric medicine. Okay, to cure Manodoshas. Pada Chatushtaya. This is very, very important in this chapter. Pada Chatushtaya refers to the pillars of treatment. There are 4 pillars of treatment. That is why it is Pada Chatushtaya. Okay. And they have 4 each qualities. Okay. They are very important, making it 16 in number total. Bhishak Dravyani Pastata Rogi Pada Chatushtayam Chikitsitasya Nirdishtam Pratyekam Tat Chaturgunam. That is Bishak, Dravya, Upastata and Rogi are Pada Chatushtaya. For the successful treatment of a Roga or a Rogi, you need 4 each qualities, Tat Chaturgunam, 4 each qualities of each Pada to achieve success in your treatment. Okay, now learning about Bishak. Who is a Bishak? He is a doctor. Dakshas Tirthartha Shastrarthu Drishta Karma Shuchir Bishak. That is, Daksha, he should be very much expert. Tirthartha Shastrartha, he should have knowledge of all what theoretically as well as practical knowledge he should be well qualified in this stream. Drishta Karma, he should be well experienced. Shuchi, very important, no? He should be very hygienic. Then, learning about Dravya. Bahukalpam Bahugunam Sampannam Yogyam Aushadam. That is Bahukalpa. With the single herb, you should be able to prepare various modes of treatment. That is, for example, if a person is unable to consume kashaya, you prepared out of a drug, it should be capable to be made into the form of a pill or a vati so that the person can consume it easily instead of kashaya. So it should be made, it should have the property that it should be made into different kalpanas for easy administration. Okay. Bahuguna. It should be broad spectrumly useful. For example, you are having thousands of diseases together. You cannot expect thousands of herbs to be available in your place to cure all such diseases. So, one herb should be capable enough to cure certain other diseases also. Sampanna, it should be easily available because always you cannot go to Himalaya to pluck a single herb for a single patient, no? So, it should be easily available. And Yogyam Aushadha, that should be relevant to the disease and the patient. Upastata. Upastata is your helper or nurse. Okay. Anurakta Shuchirdaksho Buddhiman Paricharakaha. Anurakta is he should be affectionate towards the patient. Shuchi, hygienic. Daksha, he should be skillful. If you want to insert a IV cannula or example a basti catheter into the anal canal, the person should be skillful enough not to injure the surroundings organs. Okay. Buddhiman, he should be intelligent. He should know when to administer and when to inform the doctor regarding the condition of the patient and all. Then coming to Rogi. Rogi also plays an important role. Adya Rogi Vishapvashyo Jnapakaha Satvavanapi. That is Adya. He should afford. He should be capable enough to afford the treatment, medicines and all. Bhishapvashya. He should be obedient to the doctor. See, when you advise some patya to the patient and if the patient just takes the medicine and do not follow the patya, that roga doesn't get cured. For you to have success in your treatment, the patient should be obedient to you. Okay. Jnapaka, he should have good memory power for telling us the proper history, to take medicines in the proper time. So he needs Jnapaka, good memory power. And Sattvavan, courageous. He should be capable enough to withstand your medications, withstand your treatment modality. See, if you are posting him for some surgery and the person is very much afraid, his PP gets fluctuated and you cannot perform the surgery which is life-saving. Okay, so you should choose a courageous patient. Sadhya Sadhyata of Rogas. A person comes with some roga, you should be knowing which patient you can treat, which patient you cannot treat, which is manageable, only through patyas and apatyas throughout his life, which cannot be cured at all. So, you can divide the rogas into sadhya roga and asadhya roga, which is curable, which is not. Okay, under sadhya rogas, you have two more divisions. That is Sukha Sadhya and Krichra Sadhya. Sukha Sadhya means easily curable. Okay, there are some lakshanas which we'll learn later. Krichra Sadhya is with the difficulties you can cure that disease. Okay, Asadhya, which is not at all possible to cure, you have two divisions, Yapya and Anupakrama. Yapya refers to manageable. Okay, with some medications, with some patya, you can manage it throughout your life. Anupakrama is Varjya. With anything, any circus you do, you are not able to manage it even. Okay, such things are called as Anupakrama. So now we'll learn about Sukhasadhya Lakshanas of a Vyadhi. Which Vyadhi you will call it as Sukhasadhya, easily curable. There are some specific features after observing which you can classify them as Sukhasadhya. They are, the body is able to tolerate the medications. Okay, the body, see, if all the Pada Chatushtrayas are very good, very well available, and the rogi's body is not able to tolerate your medicine, means it is a waste, no? So his body should be able to tolerate the medicines. The person who is young, in Yavana Avasya, your body will be very strong than your childhood and your old age. So when the body is, or when the person is young and male patient is said to have naturally strong power than the female people, who has control over his senses. For example, you are doing some eye treatment to the patient and you ask him not to use mobile phones too much. And if he is taking the treatment and using the mobile phones too much simultaneously, your treatment has minimal effect on the patient, no? So he should be having control over his sense organs. And when the disease do not involve the marmasthana, marmasthanas are vital points of your body. So any disease involving marmasthana is very difficult to cure, or it is not curable at all. So your disease, that is Sukhasadhya, should not involve marmasthanas. Very weak causative factors, very few purva rupas and very few lakshanas and upadravas. If it is there, it is easily curable. And when the Dushya, Desha, Rutu, Prakriti are not having similar features. Okay, suppose this season you think it is Vadaja Roga with Prakopaka Rutu means the strength of the Vyadi, Vata, is very high. It is very difficult for you to cure. Similarly, take another example. If it is a Vata Vyadi, but it is a Kapha Prakopaka Kala, it is very easily treatable, right? Because they are opposites. You will not increase Vata again. You will give Kafakara Aharas only and expel it out. The Vata will get subsided very easily. Okay. Chatushpadas are good and available. When the stars are good, that means in Jyotisha, that person's faith, that stars, everything is good. Only one dosha and one roga marga is involved, then it is very easily curable. And newly originated disease. For example, you say, yesterday you got fever, today you consulted a doctor and got it cured by tomorrow. Okay. The same thing from past 1 week you are having continuous fever, you did not show it to any physician. Today you are coming and consulting. You might have caught dengue or malaria. Who knows? So the earlier you treat, the earlier the better results. Krichra sadhya, curable with difficulty. Shastradi sadhanam krichram sankarecha tato gadaha. Disease is surgically curable and presenting with features of sukha sadhya and asadhya rogas. Okay, the disease might be having fully fledged symptoms and it is curable with difficulty, with surgery like procedures. Okay, not just with oral medications. Yapya disease, which are manageable. Okay. शेषत्वाद आयुषो याप्य पत्याभ्यासाद विपर्यये. Throughout the rest of his life, his lifespan, he should be on proper diet told by the bishak, that is your doctor, or else the roga will get exaggerated again. Can only be managed and cannot be cured. Rest of his life, the patient should follow the indicated patyahara, vihara, and aushadhas regularly. For example, madhumeha, that is your diabetes mellitus, or your hypertension, all such disorders come under manageable. They cannot be cured. Anupakrama are, they are not even manageable. It is varjya. You cannot do anything with them. With no possible signs of cure, which generate negativity, delusion, pain, features like awaiting death. Okay, all such things come under anupakrama. You can have an example of a terminal illness patient, a cancer patient with metastasis who is about to die, who is awaiting his death. That all comes under anupakrama disorders. Varjya rogis, whom you should never take for treatment. They are one who is kept away by the rulers. Why he is kept away? Because he is not obedient, or there are some other problems. That's why he is kept away, right? So you should not take him home for treatment. One who has enmity with the doctor, he can defame you in any means. If you are giving a proper medicine also, the person might have not taken it in the proper way. He will tell all the other stories to the society and defame you. So you should not take such patients who has no treatment equipments. Every time you cannot provide your equipments and treatments for free. So who cannot afford such things are varjya, who is not focused and obedient, who is about to die, who is anxious, and who is in grief and coward. who is about to die, you are just attempting to treat him. What other people say that doctor came and killed him. So do not touch such patients. Thank you so much for your patience listening and have a great day.